Hello, my name is Tolumani. Do you know you can find out if your baby is at risk with one simple test? Unity requires only one tube of blood from your arm, so it's safe for you and your baby to identify high-risk pregnancy early, easily, and accurately. Unity is a non-invasive prenatal test, NIPT, that screens a pregnant woman and the fetus for commonly inherited single-gene conditions, which includes sickle cell anemia, a common one in our environment. Unity is also a carrier screening test, as it does not only screen pregnant women, it can also screen non-pregnant females and male patients who want to know if they are carriers of any of these inherited genetic disorders. So how can you access this test? First, you contact our Genomix representative to schedule an appointment. At the appointment, the test requisition form will be filled and the consent form will be signed by the client. Then the blood sample for the test will be taken from the arm of the mother, unlike other tests where you have to take the sample directly from the fetus in the womb, which is very risky. The results will be ready within 21 working days. The result is to be reviewed with your physician. Genetic counseling is available if the need arises. What are the benefits of Unity? It is more convenient as it only requires a single tube of blood sample from the pregnant woman to run the test. This blood sample also contains the fetal DNA, which will be analyzed alongside the maternal DNA. Also, it is a safe, non-invasive test and poses no risk to the fetus. It accurately screens the cell-free fetal DNA and as such, reduces the need for paternal screening and prenatal diagnosis by over 90%. The test can be done as early as 10 weeks of pregnancy. What are the possible results that we could get? The results could either come out as negative or positive. If negative, it means that the patient is not a carrier of any of the screened genetic disorders, and so no need for NIPT on the baby. If the test is negative, my risk of being a carrier and having a child affected with these conditions is significantly reduced, but not completely eliminated. If the result comes out positive, it means that the patient is a carrier of the screened genetic disorder, and therefore NIPT is carried out on the baby. The result of NIPT on the baby can come as follows. 1. Low-risk fetus. It means that the fetus is low risk to be affected with the screened genetic disorder. The chance the baby is affected is significantly reduced, but not zero. 2. Moderate risk fetus. The fetus has a moderate risk to be affected with the screened genetic disorder. 3. High risk fetus. The fetus is high risk to be affected with the screened genetic disorder. The baby is at increased risk of being affected. Confirmatory testing via coronary virus sampling or amniocentesis is strongly recommended. Then 4. No results. A result could not be obtained due to limited cell-free fetal DNA or failed quality control metrics. Additional testing may be recommended. Here are some of the limitations of the Unity test. 1. The test cannot be carried out for a pregnancy of less than 10 weeks gestational age. And 2. The test can only be carried out for a single gestation pregnancy. Please note that no irreversible pregnancy decisions, such as pregnancy termination, should be considered based on Unity test results alone. But remember, the test is beneficial as a safe, non-invasive first-line prenatal screening test, reducing the need for prenatal diagnosis by over 90%. Only those with high-risk results are strongly recommended to have invasive prenatal testing thereafter.